Welcome to the University of Washington. I am Christy Hendrickson, the Program Director of the Medical Physics Residency Program. I appreciate your interest in our program. Thank you for agreeing to interview with us. It is a strange year with all interviews being virtual, so please feel free to reach out at any time if you have additional questions. The University of Washington is a large public university with about $750 million in total federal research grants and contracts, which is second in the nation among universities. The mission of the University of Washington Medical Center is to improve the health of the public, and we provide patient care for more than 1.7 million people every year across the region. Our patients come from diverse backgrounds, including cities, rural areas, and tribal lands. Our physics and physician faculty and staff work at several sites of practice, many specializing in an area of physics practice, but with flexibility within the team to cover at other locations. I, for example, provide physics coverage mostly at our Gamma Knife Center at Harborview Medical Center, but also clinical coverage at our main academic hospital site, the University of Washington Montlake. The strength of this practice configuration is that we are able to offer radiation therapy to our patients and clinical medical physics training with all 4 particle treatment modalities: photons, electrons, protons, and neutrons. Our program is designed to take advantage of collaborative, educational, and research interactions with radiation oncology physicians and residents and medical physicists in radiology and nuclear medicine at these locations. We offer a full spectrum of radiation oncology services, including conformal radiotherapy, IMRT, VMAT, IGRT, SRS, SPRT, IORT, TBI, SGRT, Gamma Knife, LDR and HDR brachytherapy, neutron and proton therapy. Upcoming new equipment additions include Varian Ethos and Electa Flexitron Afterloader. Let me take you on a tour of our sites. The University of Washington Medical Center Montlake is the main site of the physics residency. We have 4 Electa Linacs with capabilities for SPRT and a cyclotron for fast neutron therapy. There are 2 GE Lightspeed CT simulators in the department and a PET CT simulator in radiology. We treat intraoperative radiotherapy with the Mobitron and intravascular brachytherapy with Novo Strontium 90. LDR prostate patients are also treated in the OR suites here. We treat patients with thoracic, CNS, skin, head and neck, GI, GU, lymphoma, sarcoma, and pediatric malignancies. Research facilities include the Proton Mini Beam for flash therapy development and other proton preclinical studies, and an active radiobiology lab. The Seattle Cancer Care Alliance is 3 miles away and is the outpatient arm of our National Cancer Institute designated center. At the SSCA, we have 2 Electa linear accelerators equipped with CRAD surface-guided imaging systems and an HDR brachytherapy program with in-room cone beam CT. We treat patients for breast, prostate, gynae, and GI cancers. 2 miles south of the SSCA is Harborview Medical Center, which is the county hospital run by UW Medicine. It is the only Level 1 trauma facility in Washington state, so patients are med-flighted in from multiple areas. At Harborview, we have the Gamma Knife Icon with capability for frame and mask-based radiosurgery. On the Icon, we treat patients with CNS diseases, AVMs, and essential tremor. Harborview also has fantastic programs for providing medical and cultural interpreters as we provide care for many immigrant communities here. 6 miles north of the UW, we built the SSCA Proton Therapy Center, which is a 4-room standalone center with pencil beam and uniform scanning capabilities. Now I'd like to shift gears and tell you about the structure of our physics residency training program. The goals and objectives of our CAMPEP accredited training program are to deliver the necessary clinical experience, education, and training in radiation oncology physics to ensure a broad knowledge of clinical medical physics and a mastery of the clinical skill set, all designed to allow our graduates to function competently, independently, and safely in the clinic by the time you graduate. The decisions that we make in designing and refining the program are informed by our objective to graduate physics residents who are eligible and prepared to take ABR certification exams, knowledgeable in the ethics, legal responsibilities, and published standards of practice, competent in clinical duties, confident in communicating, presenting, and teaching, and confident problem solvers. Some of the program's strengths that I'd like to feature distinguish our training program from others. We are the only residency offering clinical experience and training with all 4 treatment modalities, conventional photons and electrons, but also neutrons and protons. We have a highly structured program with topical rotations and one-on-one mentoring with a physics faculty member. And I'd like to say a bit more about a few of our unique rotations. A sample 2-year schedule looks like this. Both junior residents will be in the intro rotation together with me, the program director, and Minson Kim, the associate program director. That is the only rotation that residents do together. After that first month, one resident will begin treatment planning, while the other resident begins the QA/QC rotation. Other rotations include equipment, clinical development, and image guidance, brachytherapy and STS-7/8, which are at the SSCA site of practice, since that is where the HDR brachy system lives, and most gynae and breast cases are treated. We have explicit rotations on SBRT and SRS, protons, an international rotation, patient safety and QI, and radiation protection. Now I would like to take some time to say a bit more about 3 of the rotations that I'm featuring. Our department has a strong safety culture and a robust near-miss incident learning system. Physics residents are expected to attend weekly meetings with staff and faculty across the department structure, where each submitted near-miss report is discussed and tagged for cause. Some require immediate follow-up. All are stored in a database that is available for mining and later analysis, such as during your safety rotation, where you learn about watershed error events, the importance of error reporting systems, and learn how to perform root cause analysis and failure mode and effects analyses, and hopefully leading to process improvements in the department. It is our goal that through your experiences in the weekly meetings and the safety rotation that you will feel prepared to start a near-miss reporting system and clinical patient safety and quality improvement program in your clinic at your next job. The STS rotation. The acronym stands for Specific Treatment Site. The aim of this rotation is to better understand the clinical decision-making process of the radiation oncologist as they tailor and prescribe therapy for individual patients, depending on many things, such as how the disease presents, available adjuvant therapies, medical history, previous irradiation, existing comorbidities, just to name a few aspects of the decision-making process. As physicists who work in a support role to our physician colleagues, we can do our job better if we can better appreciate what they're thinking as they choose this prescription or that treatment modality. Why are they compromising on tumor coverage on this SBRT case? Why are they exceeding this normal tissue tolerance? Why do I have to turn around this IMRT QA overnight for this patient? Activities include shadowing the physician on all patient interactions to observe conversations with the patient, what is discussed during the initial consult, what symptoms is the patient describing during the on-treatment visit, how is their disease progressing during the follow-up visit. You will also attend multidisciplinary tumor boards where physicians from oncology, surgery, and radiation oncology discuss individual patients and advise on the best combination treatment options. You will learn about the role that chemotherapy plays for the patients that you see in radiation oncology, or hear about the cancers where radiation therapy is not prescribed, the bigger picture of cancer care. Your role as a medical physicist is made clearer, I think, by these interactions and observations with physicians and with patients and their families. At exit interviews with graduating physicists, this rotation is most often highlighted as one of the most impactful rotations of their training experience here at the University of Washington. The international rotation is new to our program and was created last year. It is a collaboration with our institution and AIMS, the All India Institute of Medical Sciences in New Delhi. It is the top medical training facility in India. The rotation is funded currently by an NCI research grant held by Dr. Eric Ford to develop cost-effective radiation treatment delivery systems for low and middle-income countries. During this rotation, we send one physics resident and one medical resident together to Ames for 4 weeks. The rotation also includes 2 weeks for preparation and follow-up. The resident team designs and implements a quality improvement project while in country, while observing and learning how radiotherapy is delivered in low and middle income countries. 2020 was the first scheduled year in which we planned to send 2 residents. At first, departure was delayed and then unfortunately canceled by pandemic restrictions. We look forward to offering this opportunity for residents again. During the virtual residency fair in 2020, I often heard questions about what kind of research or clinical development projects are residents doing at UW. Residents are expected to choose their own projects. They might continue or expand their thesis research with one of our faculty, or join the ongoing research of a faculty member. They often choose projects related to the department's patient safety program, or follow up on a clinical issue and turn it into a publishable research project. I'd like to show you a few examples to illustrate the range of projects. Natalie has been working on several projects, including this one on film dosimetry for the proton mini beam. One of Afia's projects is a physics QA needs assessment in low and middle income countries if they were to expand IMRT offerings. In the plot, they are looking at the number of radiotherapy units available per million people in 13 centers in 6 countries in Africa and the Caribbean. The countries are Ghana, Trinidad and Tobago, Jamaica, 2 centers in South Africa, the Bahamas, and Barbados. They found that most of the centers are operating under the level recommended by the IAEA, which is 250,000 persons per LINAC. This means that the workload is already very high, delivering 3D conformal and APPA-style treatments. If cancer centers like these were to add advanced treatment options like IMRT, what are the physics QA needs? This was a preliminary study done to test the feasibility of physics QA practices in low and middle income countries. Residents Mallory Sam with physics faculty Minson Kim and physician Kent Wallner are collaborating to develop 3D TBI dosimetry and to understand how block shapes, margins affect lung and heart dose. We treat a high volume of TBI patients, including pediatrics, at UWMC and the SSEA, due to our decades-long association with the Fred Hutchinson Cancer Research Center, where bone marrow transplants post-RT were pioneered and are still routinely done. We currently have 18 physics faculty at 5 clinics, including the UWMC Montlake, Proton Therapy Center, SCCA, UWMC Northwest, and Harborview Medical Center. All faculty have 20% or more of their time for research, and all mentor in the residency program. When you click on the individual faculty members on our website, you will find a profile of our research, clinical, and educational interests. We are very proud of our alumni who have all obtained their first job prior to graduating. Here is a list of some of the locations where our recent alumni have obtained their first jobs. As a program director, my goal is that our graduates are prepared for whatever type of medical physics position most interests them, whether it be an academic appointment, clinical-only job, consulting firm, or proton position. Some graduates prefer to stay local, and others find their preferred position abroad. Our residency training program has prepared them for any of these career choices. Well, thank you for interviewing with us. Please feel free to let us know if you need any more information on areas that I didn't touch on. We look forward to learning more about you during the interview process and discussing more about what makes our physics residency program great.